Sometimes diabetes does not announce itself with a warning. For some people, the first sign may be a medical emergency. For others, high blood sugar may quietly damage the body for years before the problem is discovered. Hello everyone and welcome back to MedInsight Academy. Recall in part 1, we explained what diabetes is, the role of insulin, the different types of diabetes, and the various warning signs of diabetes. Today, we will discuss how diabetes is diagnosed, the emergencies caused by abnormal blood sugar, and the long-term complications of uncontrolled diabetes. Diabetes is diagnosed using blood glucose tests. Depending on the situation, healthcare professionals may use tests such as fasting blood glucose, random blood glucose, hemoglobin A1C, or an oral glucose tolerance test. These tests help determine whether blood glucose levels are within the normal range, in the pre-diabetes range, or in the diabetes range. As you can see, the important point is that diagnosis should be based on appropriate testing and clinical assessment. A single home glucose reading should not be used to diagnose yourself. If you're concerned about your blood sugar, talk with a healthcare professional. Diabetes can also cause blood sugar to become dangerously low. This is called hypoglycemia. Warning signs may include sweating, shaking, hunger, dizziness, weakness, confusion, and changes in behavior. Severe hypoglycemia can cause seizures or loss of consciousness and requires urgent medical attention. This hypoglycemia is particularly important for people using certain diabetes medications. This is why understanding your treatment plan and knowing the warning signs of low blood sugar is so important. Another serious emergency is diabetic ketoacidosis, commonly called DKA. When there is not enough insulin, the body cannot use glucose effectively for energy. It begins breaking down fats, producing substances called ketone. When ketones accumulate, the blood becomes dangerously acidic. Symptoms may include excessive thirst, frequent urination, nausea, vomiting, abdominal pain, deep breathing, and altered mental status. Diabetic ketoacidosis, also known as DKA, is a medical emergency that requires urgent medical treatment. Another serious condition is the hyperosmolar hyperglycemic state, also known as the HHS, which is associated with dangerously high glucose level, severe dehydration, and changes in the mental status. Both conditions require urgent medical care. The effects of diabetes are not limited to blood sugar. Persistently high blood glucose can damage blood vessels and nerves. In the eyes, it can cause diabetic retinopathy and threaten vision. In the kidneys, it can lead to diabetic kidney disease and progressive loss of kidney function. Nerve damage may cause numbness, burning, or pain, particularly in the feet. Diabetes also increases the risk of heart disease and stroke. One of the most dangerous aspects of nerve damage is that one may not feel an injury to the foot. A small wound can then become serious if it is not noticed and treated promptly. This is why regular medical follow-up and appropriate foot care are important for people living with diabetes. The good news is that these complications are not inevitable. Early diagnosis, good blood glucose control, appropriate treatment, and regular medical follow-up can significantly reduce the risk of serious complications. In this episode, we have explored how diabetes is diagnosed, the emergencies caused by abnormal blood sugar, and the long-term damages diabetes can cause. In part 3, we focus more on what you can do to prevent or control diabetes through lifestyle changes, monitoring of your blood glucose level, medications, and a practical daily habits. If you enjoyed this video, please subscribe to MedInsight Academy, like and share this video to your friends and family. See you in the next episode.